Good morning, everyone. A very warm welcome to all of you joining us today for this webinar session. I am truly delighted to have the honor of introducing our guest, Dr. Annapurna Jahnavi ma'am. Dr. Annapurna Jahnavi ma'am is BHMS CGO CCAH, graduated from the Dr. ARGHMC Andhra Pradesh in 2005. Worked as a lecturer in Bhagwan Buddha Homeopathic Medical College and Hospital, Bangalore for 2 years in Department of Gynecology and Obstetrics, practicing homeopathy since 14 years in Bangalore. Madam gives the knowledge about today. Madam gives the knowledge about the Violaceae group of medicine. So, without further delay, I invite to all of you joining me for extending warm welcome to Madam. Welcome, Madam.
Thank you, ma'am. Thank you for introducing me. Am I audible?
Yes, ma'am.
Okay. Can you let me share my screen? You need to enable me to say share my screen. Okay. Is it visible now?
Yes, ma'am. But not to
Okay. Is it visible now?
Yes. Yes.
Okay. So, good morning, everyone. Thank you, ma'am, for introducing me. And thank you for this wonderful opportunity from Swara Homeo Gurukul, as well as Vidhyadeep Homeopathy Medical College. And today my topic is Violales. Violales, it belongs to the plant family. Okay. So, what is plant family? We are seeing many webinars from Swara Homeo Gurukul, right? So the basic expressions of the plant family are sensitivity and reactivity. That is the basic expression. Okay. The expressions we see common in these cases like I'm scared, I'm shocked, I'm frustrated, I'm overwhelmed, I'm very much excited. These are all the common expressions we see in the cases of which require plant remedies. Okay, so it's a small introduction about the plant kingdom. We have many videos Sir has shared in YouTube and many webinars. You can watch it on Swara Homeo Gurukul channel so that you can understand the basic concept of the plant family. Once uh, we uh, we arrive into the plant kingdom, then there are many families like we have Violales, we have Solanaceae, we have Loganaceae, we have Leguminosae. There are many plant families. Okay, so once we start taking the case, and slowly, when the patient starts telling you all the symptoms one by one, then we need to differentiate. So now today we'll learn few things about the Violales family. Okay, there are many families included in it, like the Caricaceae, the Cistaceae, the Cucurbitaceae, the Violaceae. There are many other small families, but they are all included under one larger families that we commonly call as Violales. Why all these families are included under Violales? Let us study because they have the common sensations. What are the common sensations? Like the pains are cutting, stabbing, lancinating pains, and few common mental symptoms we see that is common in each and every small family, that is vexation. So that is the reason all these are grouped under one common larger family called Violales. Okay, so when we search the rubrics in the repertory, once we see a common, suppose we see pain. Under pain, if we see stabbing pain, we see the many remedies of these family included from these families. We see many remedies from this, and we see pain, common pain from lancinating pain. If we see the rubric, there are many remedies from these families included in that rubrics. That's how we get the common sensations. Okay, so this is Violales family. We let us see the common sensations and reactions. Okay, so the basic thing patient what he tells is aversion to be disturbed. They are uh, very like they don't want to be disturbed at all. They are vexed. They have these ailments from chagrin. Okay, they doesn't want to be interrupted. They are very much annoyed. They just say the word, don't get into my way, leave me alone, do not disturb me, do not interfere. uh, these are the common sensations we get. Okay, so what is the active reaction in the case? Its active reaction will be the rage, the violence. Okay, they become very restless. They become irritable when questioned. They become irritable when disturbed. Okay, and these are the reactions, active reactions in the case we see. Okay, what are the passive reactions? So the patient will be telling prostration, morose, I want total rest. I want to avoid people. I I don't want to be disturbed. Aversion to be disturbed. These are the passive reactions in the case. Okay. So the physical pains when we see, these are like already we discussed stitching pain, cutting, sharp, lancinating pain, pinching pain, knife like the pain is the piercing pain. So these are all the physical expressions of the pain. The patient will express the pain in such a manner. Okay, and there are few cases where we see the compensation like I'm very quiet when there is pain. I'm very quiet or I'll be peaceful. Okay, I'm very calm and composed when there is pain. So these are the compensation part of the case. So we'll see some cases we see the active reaction, some cases we see the passive reaction. We see the common sensations in all these cases. We have remedies like Elaterium, Bryonia, Colocynth, Viola tricolor, Lufa operculata, Cistus Canadensis, Viola odorata, and Passiflora incarnata. We have many other remedies from this group. So let us discuss a few remedies in detail. Okay. So these remedies are very useful in our common practice, like the acute practice. We give these remedies like Bryonia, Colocynth, Cistus Canadensis. Especially Bangalore practice, we have lot of allergic cases. In many allergic, like 30-40% of the cases we get allergic cases. Cistus Canadensis is a very useful remedy, especially in Bangalore weather. So we have cases like we have cases, acute cases as well as chronic cases. Let us discuss one by one. Okay. So Bryonia alba. Anyone in the chat box? Many people from first year they know about Bryonia alba. Anyone in the chat box? Can you type what is the common indication of Bryonia? Anyone from the students? Okay, the common thing that is the dryness, right? Okay, so Bryonia is best adapted to the persons of a gouty or rheumatic diathesis prone to so-called bilious attacks. So that is the keynote from Allen's keynote. Okay, from Allen's it is. Excessive dryness of the mucous membranes. They have the great thirst, the Allens. Bryonia patients are irritable, inclined to be vehement and angry. So we found the mental symptom vehement, angry, they are irritable, pains, stitching, tearing, worse at night. So once we see the common picture, either from the sensations or the mental symptoms or the physical ailments, we need to see the commonality. Once we see the commonality, then we can go to some family. Okay. So again, we need to see the particular symptoms once we have to prescribe a remedy. Okay. So the rubrics like mortification, chagrin, ailments from, we see the remedies like Bryonia, Colocynth, okay, and head pain, cutting, darting, stabbing. So we see these remedies like Bryonia, Colocynth, and Viola. So like that, a group study if we do bryonia again colocynth like that, once we see the common sensations, then you can keep all those remedies like the family group you can study. That is how the study of the group of remedies is very helpful. Okay, bryonia we give as acute remedy in many headaches. We give it in pains in the extremities, gouty pains, we give it summer complaints, even the renal calculi we give bryonia. So how we see bryonia, we need to see the particular symptoms of the bryonia like the great thirst, dryness of the mucous membrane. Patient will tell you like my mouth is dry, how much water I drink, it is again and again it is becoming dry, how much how many liters of water I had today since my headache started. So first thing you need, it will strike, oh maybe it is bryonia. Then you need to ask what type of pain it is. So once we see, and at the same time, these patients become irritable when there is pain. If you ask a little bit mental symptom, or if there is an attendant who is accompanied with them, they'll be telling. Since this pain has started, he has become irritable. He locked his door in, and he told everyone that don't disturb me. So then immediately, what it strikes, bryonia it is. Once we give bryonia in the potency which is required, immediately within few hours the medicine will start acting. So that is how we need to see each and every remedy. Okay, so the next remedy from this family is Colocynthis. Okay, this is called the squitting cucumber. The common name is squitting cucumber, we call it colocynth, right? So the agonizing pain. So what type of pains we give colocynth? Common, the colicky pains, right? The colicky pains, the menstrual complaints, we give the pain. So all these acutes we give commonly, we give colocynth, right? Even the back pain, colocynth works wonderful in uh, disc prolapse and all. It gives a very good relief to the patient. So once we see the symptoms like the agonizing pain in abdomen causing the patient to double bend. Why it causes the patient to double bend? Because it has the property, the pain has the property where the pressure ameliorates the patients. That is the reason patient double bend. Okay, and the patient they become restless, twisting and turning to obtain relief. Hard pressure that ameliorates. Okay, menses suppressed by chagrin. What is chagrin? What is chagrin? It is nothing but the mortification. Okay, the colicky pains, The patients are extremely irritable, impatient, becomes angry or offended on being questioned. Again, did you see the common symptom here? They become irritable, they become impatient. Okay, these are the sensations. They become angry or offended on being questioned. They throw things out of hands when in anger. Affections from anger, indignation. Again, you need to compare this remedy from this ailments from anger and indignation in with chamomilla and staph aureus, but we need to differentiate from which family it is. Okay, and again, it is a very good remedy in sciatica complaints. Okay, where the patient tells you like pressure ameliorates the pain. Okay, so these are the indications of colocynth. So in common practice, we give colocynth remedy in menstrual complaints in young girls where mothers get the girl, the patient will be double bending to get relief. So once we see the patient will like we can give very easily we can give colocynth remedy in these pains. Again, many abdominal pain, abdominal complaints when the patient double bend or when they pressure ameliorates uh, the pain, then think of colocynth. Viola odorata. This is one remedy from this family Violales, where the indications are whooping cough, dyspnea, headaches, the cancer, chorditis, the worms, and also it is a specific remedy for ear. Otoria suppressed, okay, itching at the anus, and the worms, headaches with burning in the forehead, rheumatism of the small joints. These are the indications of Viola odorata. One more remedy is bedwetting, Viola tricolor. So the indications are bedwetting and eye pains, stitching type of pain on motion, and again generalities like motion aggravation. One more remedy from this family, it is Elaterium officinarum. Okay, it is commonly indicated in beriberi, cholera, diarrhea, jaundice, vomiting and yawning, and abdomen. There is feeling of stricture or oppression of the epigastrium, dull pain in the right hypochondrium, cutting and gripping pain in the bowels, rumbling of flatters in the course of cecum and colon. The mouth, the tongue is coated white with a dirty brown fur. Okay, bitter taste in the mouth with saliva, breath, unpleasant smell. Okay, Elaterium remedy, like it is commonly indicated in the complaints of especially the digestive issues. Elaterium is a very good remedy. So I have a case of Elaterium. It's a chronic case. I'll present it to you later. And one more remedy is Cistus canadensis. It is a very useful remedy in the places of very chilled weather where the allergies are much more. Think of this remedy, Cistus canadensis. It's an ancient remedy for scrofulous affections and also in the scorbutic states and gangrenous ulcerations. Suited to scrofulous subjects who are sensitive to cold air. Okay, inhaling the slightest cold air causes sore throat. Bad effects from vexation. Again, the mind symptom, the vexation, the chagrin. So all these common sensation again from the same group. Okay, I have another case. I have a chronic case of Cistus canadensis that I'll present it to you later. One more remedy, it is Passiflora incarnata. So this remedy is much more useful in the addictions like alcoholism, insomnia, sleeplessness, and also tetanus. So commonly we give Passiflora incarnata for sleeplessness, insomnia, right? Let it be anything. In my practice, I give Passiflora mother tincture where old age people they come with sleeplessness and they want to quit uh, the tranquil and all like sleeping pills. They want to quit and they want to shift to homeopathy. So in old age people, this Passiflora incarnata works very good when you give it in drops. As acute you can give, like once you take the case then you can go and find a very good remedy, but meanwhile when the patient asks for you, this works very good when you give it in a water dose. So these are the pictures, like this lady is frustrated. This common sensation is frustration. So do not disturb, do not disturb. That is the main thing the patient says from this common sensation, do not disturb, from this Violales family. So any doubts still here? Any doubts? We'll go into cases. Any doubts still here? Anyone in the chat box? Any doubts? No doubts? Okay, let us go into the cases then. So it's a case of 50-year-old female. So the version of the patient, like I have BP, okay, headache, I get pain even if I talk to someone for some time. I have gas if I do some journey for some time. Even during the journey, she gets headache. And if she has some gas, then also she gets headache. So where the headache is, the pain is in the vertex. She cannot bear the sound of even the tap water pouring into the bucket. That sound also she cannot. She gets a headache. Okay. The main problem is my head. I pass urine 2 to 3 times at night. Head has become very weak. I cannot hear the noise when the kids are crying. I need to sp- I need to speak to the guests, right? But I cannot. I get headache. I have dust allergy and I have running nose. I have BP since 10 years. I am unbearable to the sounds since 4 years. I get headache if I go out and hear the sound of the horn of the vehicles. I used to take the tablets like cetirizine for dust allergy and I used many medicines of allopathy. Maybe this headache is due to all these medicines. Heat increased a lot and now I cannot go for allopathy. So she told many complaints. I just wrote the main points of the case here. So the next thing when Sisha stopped, I asked this question. So I need to talk to people, right? I cannot be quiet. At least I should listen to them, right? When kids shout or if plates or glasses fall, I cannot bear that. So she stopped when then I asked what will happen. Frustration. What is this noise? I cannot speak on phone. It will be good if it is silent. It will be good if there is no one. What happens if someone is there? So what she told, it will be good if there is no one. So that's why I asked this question, what happens if someone is there? The noises. I cannot bear the sound if someone makes noise. The journey also and attending function. Someone tell the words which are not good. I cannot see the light, the bright light. I cannot do anything. The pain comes down by taking the tablets. The pain, I get the pain when I eat roti, maida, and all. If I have gas, then I get the head pain. I take the tablets for BP as well as for my gas. So doctors told that it is migraine. My mom also has my migraine. My mom, it started slowly after first delivery and again it increased after the second delivery. So so with all these things I told you, you cannot take the sounds. If someone is there, you get pain, you get headache. So all these feel like what? So what she told? Frustration. Why did I talk? I can't even bang my head. It is always same. My head must be free. What is that free? I asked, meaning what? Nothing should be there. I worked in ration shop and I used to talk a lot. Now I cannot talk even if it is with my own people I cannot talk. I must stop talking on phone. I can't talk to my daughter also even for 10 minutes. My BP started when I had business tension. I get distracted as I had allergies. I can't even take ice cream in the cold weather. So when I asked about the dreams and all, there are no dreams much. When I asked about the fears, she told that her husband died during the COVID second wave and she is living with his son and their family she is living with, and she craves for the chicken sweets and all. So recently she gained weight a lot and she is now 85 kgs. Okay. So the hobbies are like I love watching TV serials. Now I stopped due to headache. This also even her hobbies also due to headache. She cannot watch any TV serials. I do namaz. I read Quran for half an hour. I used to read for half an hour. Now I can't read even more than 2 pages. This is because of this headache. So analysis of the case. So in this case, what we found out in this case, commonly everywhere in the case, what we found out. So everywhere, what the patient is telling you, everywhere, what the patient is telling you, I have the headache and I cannot bear the sounds. I cannot do this. I cannot have anything. I cannot read Quran because of all these things. So there is no animal theme like me versus you, like anything we found out in the case, nothing, no animal theme, right? So there is no mineral theme. Mineral theme is like what? I need someone or I have this capacity. Anything is there in this case? Nothing is there, right? So everywhere commonly in the case we found this type of pain, that type of pain. I get pain because of this, because of that, and due to the pain she gets frustrated and she wants to be alone. Even she cannot talk to anyone on the phone, she has to be quiet. So that is the common thing we found out in this case, right? So from this thing I could arrive to the family of Violales. Okay. And according to the symptoms of Metria medica, Bryonia, this headache, sounds aggravation, slightest disturbance aggravation. So all these things, indications of Bryonia, potency 200. I gave 3 doses. So after 1 month, her headaches has almost 1 month to 40 days. Her headaches have reduced around 30 to 40%. She was doing very much better after Bryonia 200, just 3 doses. Okay. So again, for after 3 months, I took one more follow up, and she is very happy with that uh, Bryonia. She is doing very good. After 4 or 5 months follow up, recently I took a follow up. Now she is talking to everyone on phone. Her headaches are much better. She is not like getting headache frequently like before. She is attending functions. Even her grandchildren are at home. Even if they cry, even if they make some noise, anything, she is able to manage. She is not getting the headaches as much as before. After 4 months follow up, she is doing very good with this single remedy Bryonia, and at the same time, um, her allergies all are also lesser. There are no much allergies, uh, like, because she used a lot many citizen and many allergic remedies and all, and she used to get once in, even though they stopped, once in a while, once in 2 months, like that. She used to get lot of allergy once in a while. That also she didn't get in this 4 months of follow up. So this is the case of chronic case of Bryonia. Okay, any doubts? Any doubts? Any questions? Any questions? So you can unmute and you can ask me a question. Anyone from the students? Anyone from the students? Any questions?
Ma'am, earlier you said in Bryonia there is a main theme of dryness, but in this case we didn't find any dryness.
Yes, very good question. So that is the thing. We will not find each and every symptom, okay, in the case. Okay, we will not find each and every symptom in the case. Once we start practicing, what we find is few symptoms in one patient, few symptom in one patient. That is the reason we need to go through all the rubrics, and we need to go through the different metria medicas. Okay, so if we don't find just one symptom, we cannot like delete that remedy. Okay, but we have first thing in common, we got the all the sensations of I'm frustrated, I cannot listen to the sounds, I want to be quiet. So we have arrived to one family, that is Violales, and from that Violales we have arrived like this is the remedy which covers the maximum symptoms of Bryonia. That's how we arrive to a remedy. Okay, so in few cases in acutes, we find uh, few like great dryness is there, this is there, that is there, headache, it is ameliorated by massage, or it is ameliorated by hard pressure. A few symptoms we see in one case, in other case we see this frustration, this is there. Like that we see one case, not that we see everything in one case. Okay, is it clear?
Yes, ma'am.
Okay, good. Any other questions? Any other questions? Okay, shall we go to the next case? So this is a case of chronic digestive issues. She is 69-year-old female. Okay, And she started the case like this. 1.5 years I stayed in Australia and I returned to India in February. This case I took it last year. So she is doing very good. That is the reason even now the follow up she is doing very good. That is the reason I'm presenting this case today. So I returned to India in February. Diarrhea started and appetite is not good. I do not feel like eating anything. I diagnosed with the fatty liver and vitamin B12 deficiency, and I take tablets for it 3 times a day. I have BP since 4 to 5 months. Diabetes, it started 1.5 years back, and the main symptom is what she approached for me is the diarrhea. Diarrhea, it is watery sometimes. Puffed rice, the egg roll make indigestion. I used some homeopathic combination. Temporarily, it is relieving me, but it has come back once again. I have burping, a small burps continuously. Sometimes I vomit. Okay, she is giving one by one, many symptoms. This is how the plant cases will be. It will not be like organized one after the other, one after the whatever they will get, they will tell you everything. Again, she remembered something, and again she told, I have thyroid since 1992. So again she told, I have back muscles pain since 1 month and stiffness of the muscles with pain and the brittle nails, the peeling of the nails layer by layer. So all these complaints started since few months. She was very good before that. So all these many of the complaints started one by one, just in a span of few months. So that was the reason. What happened there? I asked her. The first question was, what happened there? Because I got a doubt that something happened there. Because of that, she developed these symptoms one by one. So that was my first question. So she told, I went to Australia to take care of my kids. So the reason she went there, her second son's wife delivered a kid. So to take care of that kid, she went to Australia. Now, no walking. So after she went there to take care of kids, no walking. Lot of work as their kids were very small. Active life. Now I don't feel like very active. When she came back from Australia after 1.5 years, she is not at all active. So what affected you? Again, I asked that question. So first she hesitated to tell these things what happened. I told her these are all confidential things, but to for the case purpose, we need what happened there, what affected you there. A lot of work. I was very upset. It was a big house. I was just fed up. The daughter-in-law is very nice, but I am taking all my responsibilities on myself. Earlier I was fit. I was doing nothing, anything. Now, due to age, I get irritated. I'm sorry, this is a typing mistake. She had thyroid and she started taking 75 thyronorm. I became very fat and they gave me 125. Palpitation started, so started taking 100 micrograms. So what she told, she went there and she took up the responsibilities. Nobody gave, even her daughter-in-law, she didn't tell her to do all the work, but she started working all the things, and she started getting lot of irritation. I'm not that kind of a person. I used to feel like, what is this? What is all this work? So again, I asked, what affected you exactly? No free time. That is what her issue is. No free time. I love my me time. What is that me time? Since beginning she has that me time. I do painting. I do reading books, sleeping. That was not there. In Australia, She lost that me time. There is no free time for her. Both my daughter-in-laws are very nice, but they believe that I can handle. So she started working there, and because of that, she got lot of irritation, lot of frustration and all. So what was the feeling that time when there is no me time? So that was my question. My mood is like sleepy always. Painting wish suppressed. So she used to paint a lot. She used to read books a lot. But all that wish got suppressed. She became very moody. She is become sleepy always. I felt like irritated, angry, very touchy, taking something serious, very much irritable. Don't disturb me. Even a small mistake, I am getting irritated. I was not like that before. I was very talkative. I don't like criticizing others. I don't like someone commenting on others. Always in the jolly mood. I love my family a lot. Kids respect me a lot. My husband is very loving and caring, and fun and laughing, etc. Again, she told something else like in 2016, she got stomach pain and vomiting, and it was the interception of intestines. The surgery was done during that time. I was feeling very young until 65 years. Now I'm feeling very lazy. I'm very sleepy. Irritation very less number of times. But I regret after that. Once she gets irritated and she shouts at someone, again then she regrets after that. So I cannot take any kind of pressure. I can tell on their face that I'll not do this, I'll not do that. But for my pleasure of my kids, I can do anything. So this is the case. This is the case. And what is the chief complaint? What is the chief complaint? The chief complaint is, what is the chief complaint? It is the diarrhea. It is the diarrhea. Okay. I used to eat Maggi noodles, pasta. Now interested to eat even a piece of non-veg. I was a foodie. What are your hobbies? I used to prepare lot of dishes. People come and go to my home, giving food to my relatives. That is her hobby. She was very active. Okay. What do you crave to eat? I crave fruits, plain food, murmura, potato chips, rice, dal curry, black gram, a list of things, leafy vegetable, cucumber, eats carrot daily, she eats cucumber and carrot daily, likes pineapple juice a lot, and I like watermelon, muskmelon a lot. So what is this family? This family is Violales. Violales is all the cucumbers, all the melons. So even when you take the cravings of the patient, some or the where somewhere around they will be telling you I crave for cucumber, or cucumber doesn't suit me, or I crave melons, or either this or that, or they will tell you if I eat something like watermelon, I get diarrhea. So somewhere around there will be a relation to the whole family when you take the case. So she eats cucumber daily and she loves the melons. So again, the case analysis. So this case, I was not knowing Elaterium before. I never gave Elaterium um, until unless I had this case. So once I took this case and I did analysis, I got the common these sensations like the frustration, do not disturb me, I don't have my me time, I get irritated. All these things are I found out, but I couldn't find what is the remedy. So I took intussusception of the intestines. Long back she had the history, the back pain, muscles and all. I was thinking of Bryonia, Colocyn, this and that, but it was not suiting this diarrhea where it is. So once I took that chart, those remedies are there. Each and every remedy I have gone through this Elaterium, Viola odorata, Viola, each and every remedy I was reading in Lotus Materia Medica by Murphy. So in that, I could found out this Elaterium has very good number of digestive issues like the diarrhea, the burping, um, all these symptoms are under the Materia Medica of Elaterium. So that was the first time I tried Elaterium to this patient. I got the remedy from some local pharmacy and I gave her Elaterium 200. The diarrhea was so bad that she was coming to me. She was from my neighbor apartment. So she was calling me again and again. She was telling me, I am getting diarrhea. I had eaten a small murmura. Again, I passed stool number of times and all. So what I did, I gave 4 doses, weekly 1 dose. It's like within 1 month, the follow up was very good. Within 1 month, she told, now my appetite is bit increased in this 1 month. I'm doing good. I could eat something. That was the first change. And number of times passing stools, like she used to pass 3 to 4 times a day. Sometimes if she eats outside food, she'll be going to the washroom number of times. So, and it was a large family here, and they used to go to the outside food many number of times, and she used to come. So after Elaterium, 204 doses, first month follow up was like her number of times passing stool has come down and appetite better. So what we see, the appetite is better. That's a very good sign. So again, 2 more doses I gave for the next month. She did very good. After 2 months, she told I could eat number of foods more than this what I was eating last month. Now her diarrhea almost stopped. Now and then she has diarrhea. After 3 months, she was much better. The loose stools reduced. She was eating very good, and that frustration what she had started, that irritation and all whatever she had, everything reduced, she told, after 3 months. And she told, my one more daughter-in-law is here. I have, after 3 months, she told, I have come here because my daughter-in-law is other daughter-in-law is going to deliver a baby next few months. I have to get ready for that. Again, she told, I have become very active after the 3 months. She has become very active. She is eating very good. The diarrhea has come down. So she is doing well with this remedy, Elaterium. So this is the remedy I could found out after uh, getting this case. So once we study the family, if we study one family, if we study the common sensations, the reaction, the active reaction, the passive reaction, then we will come to know few remedies from that family. So even if we don't know, then search for the materia medica of each and every remedy. So then accordingly you can prescribe, then you get very good results. So that is how group study is. It helps us in our practice. Okay. And again you need to differentiate one remedy from the other remedy. Like again the small particulars you need to check it out from the materia medica. That's how, if you follow this sensation method, it will give you very good results. And Swara Homeo Gurukul is one which teaches us, which guides us so good, that how to study, how to go with the case first. First, you need to take the case, each and every symptom, how to take the case, how to go ahead in the case. That you need to uh, follow Swara Homeo Gurukul sir and Priyanka ma'am, Divya ma'am, teachers from Swara Homeo Gurukul. They teach you, they guide you so well to how to get the patient first. First, the patient. This patient who is suffering, who has come to your doorstep, what this patient is. Once you found out this, then next is the prescription. So, to find out what this patient is, first you need to know the case taking principles, how to talk with the patient. So each and every patient will not come and tell you, I have irritation, I have frustration. Only once you are patient is at ease. Once you are very well calm and composed and you are giving that time to the patient, then the patient will tell you each and every detail. Okay, then next is case analysis. First, to know the patient is very important. That is what we need. Okay, any doubts from this case? If it is done, we'll go to the next case. Any doubts from this case? Please unmute yourself. Anyone?
No, ma'am.
No doubts? Okay, shall we go to the next case? So this is a case of chronic allergies. Okay, this is a male patient, 30 years around. He's from Bangalore. So cold started since the age of 10 years. When he was 10 years, this cold started for him. Consulted many doctors, used many medicines and nasal sprays. Continuously, he sneezes for 50 to 60 sneezes at a time. That was his. Sometimes blood in the nasal discharge. I moved to Bangalore and these allergies and sneezes increased since last 2 years. Previously he was in Chennai, it was hot weather. Now in Bangalore, this got aggravated. Okay. So next he continued, not able to sleep at night due to this itching in the head. Due to this means the allergies, small mistakes, typing mistakes are there. I'm sorry for this. And along with these allergies, itching in the head, nose, eyes while sneezing, emulsion by massage and rubbing, burning and dryness in the eyes due to the screen time. He is a software professional. He works for number of hours. So because of this, he gets burning and dryness in his eyes due to the screen time. So there are many health issues during my childhood. I had a very severe chicken pox for 1 month. I got hospitalized for 2 weeks at the age of 13. Okay. uh, and he had some injury. His eardrum got injured. It was because of his father hit him very hard. That's the reason he had injury, and the doctors advised to go for surgery. Even that was at the age of some 15 or something that he told that history. Doctors advised to go for surgery, but he did not go. But it improved somehow. That history, like because it is good, I didn't take that history. So there are many other symptoms he was telling. So the first question what I asked, what is more bothering you? So there is lot of irritation in my head. It is more during sleep. So there is no proper sleep. It is very horrible when it happens. It is irritating if someone suggests something. Irritable. Okay, I try to anger if someone advises something. I feel like telling them, I know I can handle, because I'm handling it since my childhood, I can handle it. So you don't irritate me. That is how he is. I want to go away and I want to be quiet and calm. Irritation is more during that time. When he gets these allergies and sneezes, that time the irritation increases. Okay? He wants to be quiet and calm. Again, this common symptom. He wants to be quiet and calm. Okay, during that time, I try to suppress it. He tried to suppress that irritation. And I want to be alone, not to be disturbed. Okay, again, this common thing what we are getting in these cases, the same thing, not to be disturbed. I separate myself from people. So, what it is, this means I separate myself from people means what? I don't want to be disturbed as I don't know what I tell them harshly. So, because he doesn't want to speak to them harshly, that is the reason he separates himself. As I rub my eyes and nose a lot, I get anger on myself, irritation. I try to tap my nose very hard. I go to my room and tell them not to disturb me for some time. So once he goes from office to uh, his home, what happens is during this traveling and all, due to the dust and all, this sneezing, this allergy, this itching and rubbing, itching in the eyes and nose, everything increases. So immediately once he reaches home, what he tells everyone that don't disturb me, he'll go to his room. But still, my mom comes and asks me, shall I open the windows? That was the time he gets irritated. I tell her, leave me alone. I know how to handle, as I'm handling it since my childhood. So that's how his irritation levels. He gets irritated when these symptoms are much more. So I used to extend my work till midnight as it was beginning of my career. So he told many things about he joined office like he works till midnight. He so it is because it is the beginning of his career. He works day and night. That is the time the screen time increases. Again due to that the dryness of the eyes, itching of the eyes, all these things. And what he told like these nieces and all, I have to get married so parents are looking for an alliance. So I have to get well and I have to come out of these issues. So all these things he told many things in the case. But the important points what I took from the case, the sleep I take, it takes long time for me to get the sleep. Hobbies, I watch movies, animation, uh, like the movies like the animation, fiction, adventures, and all. Playing shuttle, I'm doing lot of workout and yoga so that he wants to become healthy. Okay, the dreams of falling is there since childhood. Sometimes there are ghost dreams. Okay, so I asked about what these ghosts will be doing in the sleep. Nothing much, he just sees the ghost, that's it. Nothing much, like no no other details. So, and the dreams as if I'm traveling or doing something with my friends. So then I asked, what are your crave? What do you crave to eat and drink? He asked. He told like, I like sweets a lot. I like the lemon rice. I used to drink a lot carbonated drinks. Now I stopped completely. I love a refrigerated watermelon. I like the ice creams, but I restrict myself as I have lot of allergies. So these are all the symptoms. Okay. So again, analysis of the case. There is no me versus you versus me. Nothing. No animal theme has come up. Okay. There is no mineral theme like I'm capable of, I'm like this. Nothing like that. So very clear symptoms. These allergies, they are a lot. They are irritating me a lot, and I have lot of allergies. I don't want to be disturbed. If someone disturbs me, I get irritated. I get frustrated. I don't want to be disturbed. That is the common thing running in the case, right? So that's how you need to look at the case. So again, it's a case of plant kingdom, clear cut case of plant kingdom. So it is from the Violales. So, Cistus canadensis is the remedy for number of allergies. We have studied the scrofulous constitutions. Even the small draft of air causes sneezes, the dust allergies, pollen allergies, many allergies we see in Cistus canadensis. So I gave the remedy in Cistus canadensis in 200 potency. I just gave um, two doses in 1 month. In between, he got fever due to something. He attended some function or something. In between, he got some fever or something. I tried not to change the remedy, but again, he used to fall sick very often before he came to me because of the dust and all. He used to get fevers. So that was the case. In between, I tried not to change the remedy, but I had to change the remedy. Restox helped him a lot. Again, I had to repeat the Cistus canadensis 200 potency. So he gave the follow up after 40 days. He told I'm better than before, but I cannot tell you like whether it is good or bad. I'm feeling little better after 40 days, but I was persistent on the same remedy because I could see the same Violales theme and the remedy. I'm very much like persistent. I know that this remedy will work. So again I repeated 2 or 3 doses. So after 3 months follow up, he was doing very good. The allergies are very less. He was very happy. He got his mother after 3 months. She had some issue with her gout and all. She came to me. Even she is from Violales family. He is doing very good. His allergies are very less, and in these 3 months, he didn't fall sick too often. And his frustration also it is very less. His mother told after 4 months follow up, like the sleep is much better after 4 months. He told my sleep, he in generally he used it takes a lot of time to fall asleep. So that was the time, uh, that was the thing he told me. But after 4 months, first time he told the sleep is much better. I could able to sleep. There is no itching, there is no irritation in the nose, eyes. All these symptoms reduced, the allergies reduced, the sneezings almost reduced to 80%. Like I was taking his mother's case and he was in the waiting room almost for 2 hours in between. Like I saw him, I listened him sneeze like only once. When he came to me first time, like even while giving the case, he was sneezing and sneezing a lot. So this is the follow-up of the case after 4 months. Very good result. So Cistus canadensis is the remedy. So this is the remedy when you don't have time for taking a chronic case, when an acute case comes up uh, in the cold weather with the draft of air, a small draft of air, when the patient is sneezing a lot, and if you see some irritation and all, as an acute, uh, I'm telling you, if you give Cistus canadensis in just 30 to 100 potency, so it works very much wonders. It will do. So that as an acute also you can give this remedy, and as a chronic remedy it give very good results. So any doubts from this case? Any doubts?
No, ma'am.
No doubts. Okay, good. No doubts means you understood everything or you didn't understand. Okay. So I had one more case of Colocynth. It was a chronic case of very severe back pain. I didn't prepare PPT because of the time constraint. It was a very severe case of back pain. Uh, he had done MRI and it was a disc prolapse. He used many painkillers. He went to many doctors and they suggested to go for some surgery. He didn't want to go because one of his brother he advised, so he came to me. So that was the case. I took his case. It was in our local language. It's Telugu. Like he gave the case that he got divorced few months back, and it's not he is not divorced. The case is in the court, and he is running often to the court for the hearing and all. And the other side of the uh, people they are doing a lot. He is very sad. This mortification, this chagrin, all these things he told me in the case. And the symptoms of the back pain, the massage or the rubbing, hard pressure ameliorates. So I remember that, no, not all the details, that rubbing ameliorates, that a little bit massage ameliorates all these things and ailments from that chagrin and mortification. So, and the indications of the colocynth in the back pain. So, that case, because of the pathology, I had to give colocynth 30 twice a day repeatedly for 1 week. I gave, and I took the, because it was a severe back pain. He is not able to sleep. He is not able to sit. It was very severe case. That case. So after for one, I told him to give me follow up after 1 week. He told little bit better, just little bit better. So again, what I did, because he had the mental symptoms, clearly clear cut case of the ailments from, so the emotional level is 200. Okay, the potency emotional level is 200. So I gave 200 colosynth 200 daily, one dose again for the next 1 week. After this 2 weeks, like, he improved a lot. He could sleep better. That much pain is not there. Some 30 to 40% relief he got. So I just I gave him once in 3 days. After that, colosynth 200. That pain came down within 1 month almost. He became better. 70 to 80% he became better. That is the case of colosynth. I did not find that case, so I could not prepare a PPT, but the main symptoms I remember. So, because there is time, I'm telling you, Colocin worked very good because of the complaints. And his brother told me, like, he gets frustration, he gets irritated a lot when there is pain. He just shouts on everyone in the family if he gets pain. He was not like that before. Because of that pain he is behaving like that. All these symptoms were there. So colocynth did wonders. He has to, like, doctors advised him to go for the surgery, spinal cord surgery, but this colocynth, because of the colocynth, there is no surgery. He did beautifully. Like, this was the case some 4 5 years back. I did this case. Even now I know the family. He is doing very good. So that is the case of colocynth. So colocynth is a very good remedy in acutes. So many cases from the abdominal colic, you need to differentiate whether it is a colic, uh, that colic. If you are in the practice, it is very important whether is it a surgical case or it is a case which has to be treated, or it is something, some pathology is there. You will have to differentiate it very good. If that is not there, you need to have the knowledge of pathology, everything, surgery, everything. Once you get it out, just go for a investigation. Just get an investigation done, some ultrasound abdomen. The case is too bad, and if you cannot handle, you have to tell them, this is not a case that I can handle. that you have to be very clear in your mind, otherwise you will be in trouble. So when you know the symptoms are very clear, it's just a normal colic. Okay, it's normal colic. Colocynth works better when the patient has this double bending due to the pain. The hard pressure ameliorates, especially young girls, even the, middle-aged women, when they come with menstrual colic, Colocynth works. It does wonders in many, many cases, whether it is associated with bleeding or it is not associated with too much of bleeding, but the pain will within minutes and within half an hour the patient gets relief. That good results we have seen with Colocynth. And if it is associated with one or the other attendants who come with the patient, they'll be telling, definitely they'll be telling, she's so irritable with the pain, she's so irritable with the pain. Then think of Violales, then think of the other remedies. That is how you need to see the case. So, any questions? Any questions from students?
Ma'am, why not one potency?
Which case, ma'am?
In every
Student.
case, the symptoms are similar to the medicine. So there is more similarity in every case. So why not one potency?
So, the sensation method, we have a few things we learned where Sankaran sir gives, where we have the levels of experience. Okay, when there are levels of, we see the levels of experience where the patient, how the patient is talking. Is it a name level? Name level is just the name diabetes or what do you call? It is hypertension, or he will tell you insomnia. So this is called the name level. Okay, so for that name level, what do you give is the six potency. Okay, or LM1 and 2 we give. So the next is the fact level. Facts are like, so they will tell you few facts like the modalities or the aggravation amelioration. So if I double bend, I get relief. Or if I drink water, my dryness of the mouth is better. Or uh, if I am lying down, my pain is better. These are all the facts. So the fact level, um, 30 potency is advised. 30 potency in fact levels. So many of the acutes we get in our general practice, day to day practice, once we follow Allen's keynote or the Fatak repertory, many all these things helps us. So once we know the remedy is clear, 30 potency, either one dose or repeated doses according to the intensity, 30 potency works much better. Okay. So next is the emotional level or the feeling level. So emotional level is like this, due to this pain I am getting irritated, I am frustrated due to this pain, or how I got this pain, I am shocked, I never ate outside food, but I wonder how I got this disease, I wonder how I got this trouble, I got into this trouble. So along with the facts and the along with the disease, he'll be giving few symptoms of emotions or his feelings, I am shocked, or how come I got this without, I'm so much worried about this pain, or I'm scared what this pain will do, whether I need to go for some investigation, doctor, or whether I need to get some blood work done. So all these are all feeling level, emotional level. So when the patient is narrating this, so we have to be very much attentive what the patient is telling. So once we find out all these feelings, everything in the what the patient narration. Then you go for the potency. It is for emotional and uh, feeling level. It is 200. Okay, the potency is 200. So it is very clear. Uh, Once the remedy is decided, the potency selection is like this. Then the delusional level. Okay, delusional level, or the what is delusional level. The patient will tell you, like, delusional level, we give 1 m potency. The patient will tell you, am I a servant? uh, he feels like as if I am a servant. He is making me do all the work in the office, and uh, as if I am a slave. He treats me as a slave. It is the delusional level. Whether the other person is treating him, whether he is thinking him as a servant or not, we do not know. But this is the delusion of this person who is undergoing the situation. He feels, what is this? Am I a slave? Am I a servant? Is making do all the works in the office. So once you listen to this type of narration in the case, but there is lot of things will be going on in the case, but this is the delusional level, for example. Then you go for the 1m potency. Okay, the next level is the sensation level, or the experience level. So it is 10m level. Okay, the patient will be describing you, like, many the experience, like as if I am in a box, as if I am caged, as if I am I am in a so there are many sensations. Once you go to that level, the patient goes to that level, as if I am going through a two walls in between, I am running. So that is the experience level. Those cases we need to give 10m once the remedy is fixed. Let it be any kingdom. Is it a plant, animal, or mineral kingdom? This is how we uh, we do the selection of the potency. This is how we select the potency. Understood?
Yes, ma'am.
Any doubts?
No, ma'am.
Okay. Any other doubts? Any other doubts? From the students, please. Any doubts? You can, everyone, you can go through the videos, you can subscribe, and you can go through the videos of Swara Homeo Gurukul channel, so that there are many video lectures of Shekhar sir, where you can clear many of your doubts. Once you start reading, it will be very useful in your day-to-day practice, who are very much aspiring to learn homeopathy, who want to become a very good homeopath. Just please go through those videos. Once you go through those videos, you will get, if you get number of doubts, you can comment in the you can ask in the comment section, or there is uh, there are many workshops. Swara is conducting 4 workshops a year, 1 week in the nature. Sir will be teaching you, sir will be clearing all the doubts. Each and every student, sir will be clearing all the doubts. It's a very good opportunity for the students, as well as practitioners, beginning practitioners, as well as who are um, who are aged advanced practitioner. Anyone can go there, they can learn, they can have their doubts cleared, each and every doubt cleared. So once you go there, who finishes a few workshops, their practice will be like very good. You should have that enthusiasm and that zeal to become a homeopath, to learn homeopathy. It is the best place to go and learn. Any doubts? So thank
If there's
you.
any doubt, question them.
Sorry. Sorry. The signal was not good.
They ask you. Network is on.
Jahnavi ma'am, her voice is not clear. Maybe her
Yes, ma'am.
connection is not good.
Yes, ma'am.
So she was about to tell that there are no questions.
Okay, ma'am. Okay.
Thank you so much for your time and efforts, ma'am.
Okay, ma'am.
Yes.
Okay. Thank you so much, Swara Homeo Gurukul. Thank you so much, Shekhar sir, for this opportunity, and thank you, Vidhyadeep University Summer School, for giving me this opportunity.
Thank you, ma'am. Welcome.
Thank you, ma'am.